mail it to you.
Sure. So we'll just give everybody 5 minutes to log in and get started.
Kimani, you can shut my laptop down, Control Alt Delete and shut it down. Close out my mail and everything, please.
Okay, it's 6:30 and we'll not waste any more time. Good evening, everybody. Welcome to Valley Family Childcare Association's monthly meeting. And we have a guest speaker as Anika Evans, Regional Manager from Community Care Licensing. And she's going to answer some of our questions and let us know some updates that, that would help all of us. Over to you, Anika.
Hello, everybody. As Shruti has said, I am Anika Evans. I'm the Regional Manager of Oakland Southeast Child Care Division of Community Care Licensing. And we deal with 3 counties. We have parts of Santa Clara County, part of Contra Costa County, and parts of Alameda County. I want to first start by saying that everything is fluid. It is changing. We've had these calls before, and it doesn't change from week to week. It doesn't change from day to day, but it changes from moment to moment. And so I will try to answer your questions as best I can, but because things are always evolving and changing, the best way to get the most up-to-date information is to go on our website and look at our PINs, the Provider Information Network notices. A lot of times you guys have the information before we have them at our office level. And so, but that's the best way to get all of the understanding. There are different county ordinances and county guidelines that you guys can follow, whichever. You guys are in Alameda County, is that correct? Yeah, you're in Alameda County. So what I will do, I was just telling Shruti, I wasn't thinking, I will send the most up-to-date ordinances that they have. We just received that today in our email. And so when we end this call, I will send that to Shruti by tomorrow morning, and she can get that out to you. That it talks about the different cohorts, sizes. It talks about cleaning protocols and things like that. So I think that that would be a big help. I'm not sure if they actually publish it on our website. So I will just send the email from myself to Shruti first thing in the morning. So we do have a licensing call that's coming up on March the 18th. You can go on our website and it's a Zoom call. It's led by our child care advocates. So the main speaker will be Tani Grossman or Natalie Dunaway. However, both offices, Oakland South as well as Oakland North, we will all be on the call. Our managers will be on the call. And usually what happens in those calls is they give you the most up-to-date information. Also, you have an opportunity to type a question in the chat, and our managers are manning those boxes and giving you the websites, giving you all the answers. So I encourage you all to be on that call. This time the call will be at 2:00 in the afternoon. We're kind of fluctuating where we do them in the evening and in the afternoon. The afternoon more so to try to be open and available to those that are in child care centers. I know family child care homes, it's easier for you guys to do most of the calls on in the evening time, but what we're going to do is every other month we'll do it that way, because we, as in me, we don't get any paid overtime or anything like that. And when we're doing calls after 6, that's on our time. And so we want to try to accommodate you, but at the same time, we too have families and things, life after work. So Shruti told me about the wonderful about the wonderful petition you guys have, and I applaud you guys. I really, really do. I want you to know that we take your concerns very seriously. And what I was sharing with her before you all got on the call is we have those same concerns. Our licensing program analysts, our managers, we have those same concerns with us coming into the homes, into the centers. We share with the concern, is it too soon? But what I was sharing with her that I would like to let you guys know is all field staff, including myself, it's a mandate that we are COVID tested every week. We are not allowed into the field until we get the clearance from our health and safety department. So what happens is Department of Social Services are doing these tests. We get the test, it goes to the lab, and then we get the results back. We have to upload the results, and it goes to our health department. They look and ensure that those are clearances. Then they send the manager an email stating this person is cleared to go in the field. What I was sharing with Shruti is that gives us a window to go in the field, maybe 3 days, because then we're turning right back around and have to be COVID tested again. So I'm hoping that that'll bring you guys some calm and some understanding that we are not just letting people go out in the field without them being cleared to go in the field. We also have something that's called fit testing that we are doing, and that starts really, really soon. I anticipate them really going full throttle in the field unless you have a complaint right now or it's an application, but full throttle as far as with the annual visits. I anticipate them going in the field maybe beginning April. I did receive the notification about the petition, and it has been elevated. So it went up to the assistant program administrator, went up to the program administrator for their advice as to how do we proceed with that because of your cares and your concerns. And that was only when it was 300 and something, but as Shruti told me, now it's over 400. And so I don't want you guys to think, and I mean this with no disrespect, we don't want to see y'all and come in your house either. We don't want to, we don't want to. But as I was sharing with Shruti, how I had to really make my staff understand, we go to the grocery store, we go to the gas station, we go to Costco, we go into the hospital. Sometimes we're out and we're doing things. It's no different with us coming into your homes. But I want you to know from the department standpoint, we're taking every precaution to ensure your safety as well as ensure our own safety. We all have to go home to our own families. They will have on all PPE. It won't be a thin mask. They'll be wearing 2 masks. They'll have on a shield. They'll have on gloves. We strip down, we sanitize before we come in, when we go out. If, weather permits and you have a space for them to sit outside, that's not a problem. We just need to come and view the facility. We may ask you to bring the files to us outside. So understand that we want to partner with you and we want to work with you. We're not trying to make it difficult for you, and we don't want you to make it difficult for us. It is our goal to get in and get out. We've never been ones, I know we've had a few clipboard commandos here and there, but we've never been where we want to shut you guys down or we want to cite, because guess what? That's more work for us. We don't want to do that. We just want to make sure that you're maintaining compliance. And most of my staff have my card, but they have their own business cards. On any reports we leave you, at the bottom of that report is their supervisor's direct number. If you have any issue, if you feel that they've been there too long. And again, this is your home and we want to be respectful of such. All I'm asking is that you request proper identification to ensure that they are from our department. But if you feel that they've been in there too long, give us a call and let us know. And you can tell them, but as I'm stating, our analysts are having troubles. They don't really want to go out either, but that's their job. So they really are trying to get in and get out. So what you can do for us is have your stuff ready. Again, we can't tell you by law, we can't tell you when we're coming, but I am, and I've actually just had a meeting with all of my staff today to remind them. So you may get a little call to say, hey, we starting to come back out, or you may get a letter. These are the things that I need you to have. And they can give you a listing, they can email you Make sure that your analyst has your email so that we can let you know, hey, we'll be out within the next 30 days. That's kind of giving you a heads up. They may ask you, are you guys, well, nothing is open now, but I always encourage them to ask you, do you have specific days at the library or at the park, specific times when you're not there? If your children are napping, or, I mean, you know what I'm saying? We want to make it the easiest transition as possible. Some people don't want people coming in during nap. Some people prefer it because then they can give you their undivided attention. They can give you the records. We can get in and we can get out, and you don't have to worry about the children. So whatever works for you, speak with your analyst. If you don't know who your analyst is, you can always call our main line. We always have 2 analysts on duty. We have our support staff, but you can tell them your zip code and they can let you know who your analyst is. They can give you their email. They can give you their direct phone number. So if you have any questions, and then you can ask who their manager is and you can talk with the managers. We're always available to try to make you comfortable and try to make you understand. I started off with telling you that we're trying to partner with you, but everything is fluid, which means it's always changing. We can't hardly keep up. And I've always been very transparent when I've met with you all, and it's still the same thing. It's frustrating not only to you, it's frustrating to us as well, because you have Sacramento handing down these things who are not in the field and they don't understand the different demographics. You know, they have this one rule going across the entire state. It's like, okay, that doesn't work for here, or it works for here, but it doesn't work in a rural area. I mean, you know what I'm saying? So it's things like that that we're always kind of going back and forth with. But understand, when I get an email or I'm informed that you guys are concerned about something, we take those concerns very seriously. I immediately elevate them to my boss, who then has to elevate them to his boss, Shanice Orem. And from there, it goes to agency. That's when they're talking to Kim Johnson. And I'm on so many meetings. I'm so tired of Zoom, but that's where we are, you know, literally meetings all day, sometimes over the weekends, things like that. So we are taking your concerns very seriously. You can definitely ask analysts whenever they begin to get back in the field, if they can sanitize when they come in. You can have a specific chair for them somewhere, you know, that you can sanitize instead of having them on your sofa. And I'm speaking for the homes. I know in centers, we try to ask you to have us a designated area where we can sit kind of out of the way. Usually it's in the director's office, or you have a side office or something like that. Just kind of prepare yourselves for these visits. But I promise you, we don't want to be in there, just like you guys don't want us in there. So it's going to be an in and an out. And if you have everything ready for us, we can go, okay, yep, that's good, okay. And we're not doing like before. When I was an analyst, we were required to do at least like 4 visits in a day, 4 to 6 visits in a day. There's no way we're trying to do that, because we don't want to do the cross-contamination. As it stands right now, it may be 1 to 2 visits a day. And they'll be in between. You got 1 in the morning, okay, go and sanitize and do everything, have your lunch or whatever, and then you sanitize again before you go on the next visit. A lot of our analysts are germophobics. So, you know, it's like if they come in with a spacesuit, don't be annoyed, don't be offended. Just understand that's just kind of what they're doing. And then they take it off and put it in the trunks of their cars, because as I stated, we go home to our families as well. And we want to ensure that we are safe. Childcare is, for me, the easiest and the best, because we are partnered. Our sister agencies are for adult and senior care. They have to go and spend oodles of times in these residential care facilities, checking medicines. And that was where COVID lived, you know, but none of our analysts had to do that. So we're here to work with you, but your petition has been elevated, and I'll definitely let you know how that goes. When I saw it, I just cracked up and I was just like, oh, okay. But you know, I didn't take it personal. We understand that and I'm talking from a regional manager perspective, I don't think what you guys are doing is wrong. That's the only way we're going to have a voice, because we've been saying it, but they're not listening to us. So they have to hear it from you. And so I did elevate it up. So I'm sure they were on a meeting with it this afternoon, and I have to meet with them. I have a meeting tomorrow and I have another one on Thursday. So at that time, I'm sure I'll know some more information. So Shruti, just be expecting an email from me by Friday as to where we are and what we're doing with that. So now that I am standing in front of the firing squad, I will say, be gentle, and I will try to answer your questions. So I don't know if Shruti wants you to raise your hand.
We have some questions that we submitted you, but before that, I have a quick question. So
Okay.
I was reading the county orders that we had released in today, and it says non-essential office remote work only when we are in red tier. So how is licensing planning to address this? Because a licensing visit would not be an essential work from what.
But it is.
Okay.
It is. We have always, from the gate of COVID, we have been listed as essential workers. Okay. And so whereas a lot of people have been telecommuting or they've been working remotely from home, not us. I've literally been in the physical office every day but luckily I got my own office so I can close the door. But because we are a public entity, we have to be open. So if people want to come in, submit an application, want to pay fees, they want to come in and deal with certain things, non-compliance conferences and things like that, we are open. We are taking every precaution. We are essential workers. We've always been listed per Gavin Newsom, per the governor's order. Anything to do with childcare is essential workers. And because we regulate children, family, home daycares, and childcare centers, we have been looked upon like the health care workers. We are essential workers. So everybody's center has not been open, the centers or the family childcare homes. I know initially they were giving off waivers and allowing people that were smalls, they were allowing them to operate as larges, but all of that is kind of ended. You had a specific date that you had to put in an application to become a large. Some of those things have been put on the back burner because remember, it's not just us, but we're working with other agencies. We're working with fire departments. Some of them were still out. Some of them were not doing field visits. We, for the better part of about 8 or 9 months, were doing visits virtually. That got on y'all nerves. It got on our nerves because everybody didn't have an iPad, an iPhone. Everybody wasn't privy to Zoom. They didn't know how to do FaceTime. So we ran into all of these problems and all of these nuances. And it's been very, very interesting. One of the things that we have been sending up to program is everybody is not tech savvy. We've always had that even with the forms. Everybody don't have the people that have been in the business for many, many years may not be tech savvy. Shruti and I were just talking about it. I mean, I deal with a computer every day, but I was asking my daughter, okay, wait, how do I do this? Do this, do that. And I deal with Zoom every day. So I do it every day. So imagine somebody who don't have a smartphone or who's not doing this every day. So understand that at the regional office level, we really are fighting with and for you. With you meaning we're standing side by side with you saying the same thing, and we're fighting for you. A lot of things that we do at the regional office level, it's handed down from our program office. So we're kind of like the middleman, just passing on the message type thing, yet we have to regulate it. But we are considered essential. We are, and you are considered essential.
Thank you for that. The next question is, how many appointments in one day and how long would a visit appointment should be?
Okay, so it depends on if it's a child care center or a family child care home. If it's a small family home, if it's a large family home. So it's no different, but I don't expect them to be there hours upon hours. I'm hoping if everybody has everything, you have everything that they need sitting right there for them. They do a quick little once over just to see and make sure that it's clear and clean. I don't anticipate them being there more than an hour and a half, if that. Now, it depends on how big your home is. It depends on what kind of situation they're walking into. If you have a lot of things where you need to be cited for, then the visit takes a lot longer. We have just been trained on the new inspection tool. And so with this inspection tool, how they have to go about doing it, and I've really been pushing for there to be on our local licensing calls, if we can have somebody from our training department to kind of, you know, come and train and give all of our providers an assessment of what to expect. This is what it's going to be. This is how it's going to be, more than just a pen. Because me, I'm kind of like a hands-on, and I'm a visual learner. I need to see what you're doing, opposed to you just telling me, oh, we have this new tool and they're just going to come in and do all of these check marks. It's not just check marks. So they can check the boxes. They're going to look for these specific things, you know, as far as your fire extinguisher, you know, the main things that we've looked for, make sure there are no sharp objects accessible to the children or things like that. But then they have to write the report. We are really trying to prep our analysts to try to get as much as they can done before they get there. That way, what I'm saying is they can have a report already pre-populated, but they have to go in and tailor it to your home. So you can have a base report of, you know, LPA, Mickey Mouse met with, then it's blank. They have to put your name in there. This is a 3-bedroom, single family home, single story, you know, but then they have to change it. If this is a dual story, only the first story is, you know, first level is on limits to children and things like that. So we're trying to work smarter and not harder. And we're trying to make the visits go as quickly as we can. But again, if there are things that we have to cite for, that makes us have to take a little bit longer. But we really have encouraged them, if there are citations and things like that, find a place outside or go back to your car, write the report and come back in and say, okay, this is the report. They can read it to you, go over it with you. But we really are trying to minimize their time in your facility as much as possible.
Okay, thank you. The next question is, we had an in-person inspection a few weeks ago. All 3 people who entered my house had only one thin mask, no shield or other protective wear, and they stayed for 1.5 hours. Can you assure that they will wear proper protection?
Yes, I can. So as I stated, we just got the mandate where we have to do what's called fit testing. And so they are sending N95 masks to us, where they have to properly be fitted for each individual analyst. We have some analysts that have some issues with that. So then they'll have on a thinner mask, but they'll also have on the shield. If that doesn't work for them or whatever, then they're gonna have on the bubble with the pipe, you know, looking like they in a sci-fi movie. They'll have that on. I mean, you know what I'm saying? So we have to go through all of that. And they have to do the fit testing before they're released out into the field to do the annual inspections. What you've seen them for now has been for applications, a new application when you're trying to get a license, or you're getting an increase in capacity, or if there's a complaint. That's what you've been seeing us for now. Everything else is kind of, we've been trying to do it virtually, but we've been trying to ease into these field visits. But again, your assurance is to know that they have been COVID tested and they've been cleared, and that clearance really only gives them a window of 2 to 3 days before they have to be retested again. And they can only go if they are cleared. If we don't have clearance, they will not be at your house.
Okay.
And the clearance can be if they didn't get tested that week, they can't go out.
Okay.
And they can't just choose like, oh, I'm not going to get tested, you know, and go 3 or 4 weeks. So I'm not going out in the field. No, because then that becomes a different issue, because you're an analyst and 50% of your job is in the field. So understand that we're working with all of that. Now, when you get 3 people showing up to your house, please understand Oakland South is a newly established office. Our managers have a lot of experience. We have over 44 years of experience, 15 of which I've been in it, for the office. Our analysts, a lot of them are new. and not new where they don't know what to do, because through this COVID, we've been training them. They're sick of training, but they've been through our LPA Academy. But as we know it, as I knew it, being a licensing program analyst, it has all shifted. So I'm learning what it is to be an LPA now, because we've done so many things virtually. It's not like it was before, you know? So I'm asking, when you see 3 people, it's usually because somebody is training. We're trying to get them all acclimated to going out. And the 3 persons, you might have seen a manager and 2 analysts. And that's because they had another facility to go to that they were working on a complaint more so. And so we're just trying to get them to understand what you need to do with the complaint. Because normally you don't see managers out there. When you see a manager, it's because we're either doing a spot check where we're checking how they're conducting themselves in the field, which of course they're going to clean up and be very nice when we're there. You may start getting a call or an email from a manager asking you, how was your visit? Did they present themselves in a professional manner? Usually if you get cited, you have negative things to say, but if not, you know what I'm saying? It's like, oh, it was great. You know what I'm saying? Or if you feel like they stayed in the facility too long, I need to know that. So go ahead and let their manager know, and we can try to see how we can condense that time and come down on that time.
So I think the next question is apt for this. I had an appointment that lasted from 8 to 12:30, 4.5 hours. Is that normal? My husband had to stay home to help me out with children.
Good God from glory. What kind of visit was it? Was
Um,
it a pre-licensing? Pre-licensings can sometimes be the lengthiest visit because they have to explain all of the paperwork to you. So that takes a little bit longer. Longer visits usually and normally have been because they found a lot of issues that were wrong and they were trying to deal with citations. Again, you may have had a newer analyst that was kind of scared, but you can always let them know, hey, I have an appointment. Can we continue this visit at another time? It's not ideal that we want to come back, but if that's the situation, you can always contact our office and ask for their manager, ask for me. They'll find me and I'll get back to you, email me. But again, it is not our practice to want to be in any facility, even a school, for 4 hours. Usually if I was in a school for 4 hours, they had 3 different components. So I was doing the infant license, the preschool license, and the school age license. That takes time because we have to go through records for the staff. We have to go through children's records. But I assure you, that's not on a normal. Whoever wrote that, Shruti, give them my email so I can find out which analyst that was, and we can correct that, because that's not okay.
Sure, I'll send that to him. The next question is, what if an analyst catches COVID during those 3-day window right after the test?
Right, I'm with you. That's always been my thing. I never understood, you know, with them mandating us, I didn't know that I had to be a medical assistant because I have to sit there and watch them do the COVID test. I have to actually enter the stuff in. And that's always been my question, because you can test negative today and then catch it tomorrow. So, you know, I understand that concern. Please know that those concerns have been elevated as well by the analysts, by the management teams. Yeah, that's one of those that I can't answer, but what I can do is I can get with Alameda County, the representative for the Department of Public Health. Her name is Lisa Erickson. And Lisa is wonderful to answer questions. She's been wonderful to help us with our licensing calls, to give us the most up-to-date thing. But then I go back again to the same with you. We go in the grocery stores, we go to the gas stations, we are out doing what we need to do to get fresh air and everything. And to be honest with you, nobody really knows. You know, first it was one thing, you can't do this. Now it's like, oh no, yeah, you can do this. I'm not completely sold on the vaccination, but people are being vaccinated. It's too new for me to think that, oh, okay, this is just going to keep you from everything. I'm one of those old timers that know it needs to be around for some years before I can do that. So all that I can tell you with that is we are trying to do our due diligence to ensure your safety and our analyst safety. You guys have very valid concerns, and I will definitely be taking these back to the higher ups and say, hey, these are the questions that are out there, and how do we answer that? So with that, all I can say, if there's anybody on here that prays, pray. And make sure you got some Lysol. I mean, you know what I'm saying? It's okay to sanitize when they come in, when they go out. Even for your own family, if they're not staying in the house and you're watching them 24 hours a day, you just have to do your due diligence in the best that you can with washing your hands, making sure you're wiping down and sanitizing things, with bleach, even with the toys that children are playing with, books, things like that. There are some studies out that says, you know, it stays alive on specific surfaces for 6 hours, and then some it's 2 hours. I mean, you know, all of that, you get all of these things. What I can tell you is I want you guys to be up to date with the news, but I don't want you to watch the news too much. I don't want you to do that, because you're going to get all of these different things, and it really will stress you out. Yeah, it really will. Don't do that. Don't do that. So yeah, so that's all that I got for that answer, but know that I've asked that question as well, because somebody can't be COVID tested every day. It takes 2 days to get a turnaround. So, you know, but when they have the test, again, they're not allowed to go out, you know, but like you said, you get it when you walked into another facility. We take that chance when walking into the grocery store. That's just kind of where I am with that.
Okay, I'm going to take a few questions that came to us through email.
Okay.
We have an infant program with toddler option with 2 stable cohorts. Are there any licensing restrictions on usage of sandboxes or play area equipment due to COVID?
Not to my knowledge. The same things apply where you have to go and inspect it before children occupy the sandboxes and things like that. You want to make sure no raccoons and cats, you know, feces and stuff is in there. Again, even with that, as much as you can, listen, I want you guys to know, we know how difficult it is to practice social distancing with children. All that we're asking is that you do the very best that you can. As much as you can, make sure that the children wear the masks if they're over the age of 2. We do not want them, we do not advocate them sleeping with masks on. So remove the mask, because we don't want any suffocations during that, you know. But there are no regulations as it pertains to outdoor play equipment. What we have been instructed and asked to press and encourage is make sure there is clear air flowing through if weather permits. You have windows open, you have, you know, doors open if you can. If not, just make sure that, you know, kids are in different areas in the cohorts and stuff as well. But there's nothing that I know that's been regulated dealing with outside.
Okay, and then are we still maintaining 6 feet between cribs? And within the stable cohorts, can they go back to 3?
You know, that's the first time that's been asked of me. So I don't want to give you the wrong answer on that. I think we should stick with the 6 feet. I know it's next to impossible when you have cots down for them all to be 6 feet away. So what we're asking is to make sure you do them head to toe. You get, you know, you put them apart as much as you can, but you sleep them one head at this end, you know, one head at that end. So it's like head to toe, altering them. Try to space them out as much as possible. As far as the cribs, if you can spare the 6 feet, then do that. But I don't remember going through any of our pins or our ROMs to note if they said anything different. I will look and I can get back to you, but I don't think anything has been changed on that.
If an employee cannot receive an influenza immunization, can they not have signed a statement to decline?
No, if they don't want to do the, if they don't want to take the flu shot, it doesn't have to be on any special form, they can write it on a napkin, as long as it's in their file saying, I refuse the flu shot.
Okay. I would like to know if the cohort size are expected to increase for fall.
Probably not. I think we're at our max right now. I know that the group sizing and everything, it can be up to 16. And of the 16, at least 2 has to be adults. But that you don't have to stick with that. You could have 4 adults, and 12 children, or 6 adults and 10 children, however you want to break that down. You want to continue to follow the county guidelines, whatever is the more stringent. We will allow up to 16 in one group. Excuse me. But yeah, if it still says 10 or 12, whichever it is, you want to go with the more stringent.
Okay. I have a large childcare facility in Bay Area for up to 14 kids. Currently, I have 12 enrolled in my program. The following: 1 infant, 16 months, 8 children between ages 2 and 3, and 4 children enrolled in kindergarten beginning in August. Given the pandemic and uncertainty around when my children enrolled in kindergarten can begin in person, I had a quick question to clarify. One of the current family whose child falls under the currently enrolled kindergartner category is interested in enrolling their second child. So my question is, if my 3 children enrolled in kindergarten are considered school age, if I were to accept my current student's sibling, will I meet ratio requirements?
If they are already enrolled in kindergarten where they have attended kindergarten, then they are considered school age. They are considered school age. So you should be able to enroll that extra child. Now, if they are just of kindergarten age, but they're not enrolled, then that's a problem. They're still listed as pre-K. So they have to be enrolled in kindergarten, not just of age. They have to be enrolled.
Okay.
Can I ask a clarifying question, please?
Yes, ma'am.
So enrolled and have attended? So for example, my child's enrolled to start in August, but they're not going to actually start until August.
They should have attended. They should be in attendance.
Thank you.
Yes. Thank you, Dominique, for that. Yeah, Donna Marie, I'm sorry. They should be in attending. Like we had a lot of those questions with like the TK, right? The transitional kindergarten and things like that. So they can be of age, they can be enrolled, but they need to have gone to that program. And guess what? We're doing all of that, the distance learning. So if they are attending via Zoom or whatever, then they're attending. And that's what it is. I hope that clarified it somewhat.
Okay, thank you. We saw in the meeting with community care licensing hosted that the chat mentioned there were 19 kids in a program instead of 14. I'm a large family program and want to know how does that work, because I thought we were 14.
And it was a family home childcare.
Yeah. So I think in the chat,
I don't know how that works because they can't have 19 in a family home childcare. They all of the waivers come by my desk. They come through me for them. Go ahead.
This was mentioned on the chat, and I think that was a little confusing on the community care licensing call, that we can go up to 14, 16, and 19 with the number of adults in the call in the house, and that's what I think the clarification wants to be.
No, family home childcare, no. Unless there was a waiver and exception, and I haven't done any of those. The 16 cohort and everything, usually that's geared towards schools because that's when they have the room and they have the adults to man the capacity. You cannot run your family home childcare like it's a childcare center.
Okay.
They are under 2 different regulatory codes.
Okay, thank you. The sleep safe nap log, do we have to make does it have to be for infants under 24 months or 12 months? That's the first question. And then second thing is, can we make an electronic log instead of having it on the sheet for records?
For the sleep log,
Yeah.
I don't know that you can't. So I'll say that. So it's fine, but just anytime you have any type of electronic, even like sign-in sheets and everything like that, you have to have a backup, a written. So when we ask, you can give it to me right then. If the power goes out, you need to be able to have where you can know who's all in attendance and things like that. So it's the same for the sleep nap log. You can have it on your computer and everything, but when licensing comes and we ask you to see it, you have to be able to print it out for us.
Okay.
Did that clear? Did
Yeah.
that answer that? Okay.
Now we are all getting COVID vaccines. Do we need to maintain a record of that as well for every family member in our house who have received it and staff, or it's not a requirement yet?
It is not yet a requirement. I think that would be one of those best practice things. If everyone is receiving the COVID vaccine, it would be good to have it on record, just to have what I always share with my analysts and what I tell my team is always cover your assets. So the more you have, it's not a problem. And the quicker you want us out of your facility, have records. We ain't got to ask those questions.
Yeah. Are there any new postings we need to put on our walls before the analysts start coming in?
None that I know of outside of what they did during those harassing RAS calls. Did I say that? Those, I got to tell y'all, they were awful. They were awful, not just for you. They were awful for us. But and that was 68 pages, 36 pages or whatever. And some people, poor things, they just plastered them all over. It was like, no, we don't need them all over the wall like that. Just have them where they can be seen. You know, there are a few, I think it's like maybe 7 that needed to be seen. And, you know, as long as you have them posted, they can be behind it. But there's no new postings that I'm aware of. But if there's anything, I'm sure the analysts will contact you via email or phone call and say, hey, make sure you have this, and this. Because I'm telling you, we try not to cite you. So we want you to be prepared so we can get in and get out.
Okay. I have 6 children. 2 of them are 18 months. They go down around 115. And at that time, I'm starving. I have been looking at their every need since 7:30 a.m. So I get my lunch, and once in a while, so basically what they're asking is if when they're having their lunch, they've not recorded the sleep log. Is that okay?
No, I think, is it every 15 minutes? Yeah. So no, you still have to go ahead and record it. Now, if you've been in this business for a minute, you gotta know, you gotta eat when you can. You can't sit down and have a 3 to 5 course meal during the day. So you gotta snack when the kids are snacking, have you some carrots to keep your energy and things going like that. So again, we wanna work smarter and not harder. So what I would suggest to this person, and I know you've been giving care to them, have you some crackers on the side, right? Some graham crackers, have you some fruit. You give the kids some snacks in between. You got to snack when they're snacking. Okay. You got to snack when they're snacking. Yes, go ahead, Valerie.
That's, that she worded it kind of, the question was,
okay,
I've been doing daycare for 23 years and I am really good about checking the kids and so forth. But once in a great while, I'm going to be honest, I look and I'm like, oh my God, I missed that 15-minute check. Oh my God. And then I'll write it down. But let's just say the analyst shows up and I missed that 50, but you see, I've done all of them for however long we've been doing this. Would they write me up? That's my question. One little slip.
Got you. Shame on you, Valerie. Don't you slip.
I know.
No,
I know. I get so upset.
You know you're perfect. What's wrong with you? No, okay. So let me tell you, we have moved into this new culture, we being licensing. We really are trying to work with you. We are trying to cite less. And for one slip, I'm really hoping that they would not cite you for such. If anything, they would give you what's called an advisory notice. And what that is it just lets you know, like, hey, I saw this, we talked about this. Let's please, try to refrain from doing stuff like this. The advisory notices is only between you and the analyst or you and licensing. That does not go on the transparency website. Now, if we did that and we gave you an advisory notice and then we come back next year and we see you've slipped a few more times, okay, now we have to talk about citing because we have this conversation. But we look at things from human error. And this is something that I continue to promote to all of the analysts. Most of the analysts, most of the ones that we have are parents, and they understand. I come from a world where I worked in a family home daycare. I've worked in a child care center. I've been an analyst. Now I'm in management. I understand stuff happens. And if it's stuff that can be corrected, it was oops, a slip, we can talk about it. And that's how I used to always deal with my visits. You know what I'm saying? If the battery is going out on the battery is going out on the smoke detector, you got another battery? Okay, put the battery in there. So I have to write that this is what it was, but we fixed it. It was corrected right during the visit. Stuff happens, life happens. We have our families, we have a lot going on. And tending to the children, please understand, I know, we know, and all management looks at it as these things can happen. These things can happen. You're very welcome.
Okay.
Can I ask one?
Valerie, do you
follow-up
want to ask
question?
your next question about masks?
Oh,
Okay.
yeah, my last question. I'm sorry. I'm just so stressed out this year. Now I have some little ones. Can she hear me?
Yeah.
Yes,
I
ma'am.
have some little ones. They're about, they're like 2.5. I put the masks on them and they'll rip them off during the day. Could I be cited for that? If they
No.
don't want to wear it? Because I'm
There
trying
are-
so hard.
No,
But-
there are not any regulations, any regulatory anythings where we can cite you for people not wearing masks.
Okay.
With that,
Yeah.
Now with that, we do need to see that you are trying to make sure that everybody stays in compliance, because the thing is, we are again trying to make sure and ensure that not only they're safe, but all the other children are safe. Your family is safe, because once they leave your care, we don't know where they're going. You know what I'm saying? We don't know how many times they've been at grandma's house or the neighbor's house or things like that. So what we would like to suggest is that, you have these focused circle times where they understand you got to keep your mask on. You make it into a game. You come up with different things. This is so important. You find cartoons. There's a lot of them even out there now on YouTube and things like that, that shows if you don't wear your mask, this could happen. You can be sick. We don't want to be sick, talk to them about how it feels to be sick and a tummy ache, and they won't be able to play with their friends. They won't be able to eat ice cream and things like that. So they got to keep their mask on. If they don't, we can't force it, because then we run into personal rights situation, because now we're restraining and forcing them to do something. So as much as you can, try to model the way, keeping yours on and say, hey, look, your friend has it on, keep it on. But even make sure that when they go outside, you take them outside. If you see that they're frustrated with them, everybody, let's go outside. Take your mask down. Let's breathe in good air. Let's let out good air. Let them run around the yard a couple of times. Okay, we're going back inside, so we got to put our mask back on to make sure everybody's safe. So it's all in how you kind of administer it to the children. You may have some children that just be like, I don't want this on. I ain't gonna leave it on. But you talk with the parents, tell them, if you can try to help us, you get out some, okay, I'm finna show my age, some ditto sheets, how you have these things. Give them to the parents so it'll help them. Talk with your resource and referral agency. They may have little things that the parents can do at home, and you guys partner doing the same thing. So if they're getting it at home and they're getting it from you guys, and the kids is like, oh, okay, well, maybe this is the norm. This is what we're supposed to do. But it's kind of hard, especially with the younger children. But don't force them to do it. But as much as you can have them do it. But you will not be cited for such. You won't even get a technical advisory note for that. We just may mention, we spoke with you about suggesting that you do different things to make sure children maintain that safety.
Okay. One question that I have with mask is CDC just released a statement saying that if you're fully vaccinated, you don't need masks, you don't need social distancing. And providers who are fully vaccinated, would they have to be wearing masks, or is it still just a recommendation?
It's a strong recommendation. So again, even with the CDC, that's what they're saying today. Vaccine haven't been out long enough for me. I mean, no, I'm serious. I mean, you know what I'm saying? Because they started out with you can't touch certain things. Then it was no, it's through the breathing. Then it was this, you get some eye secretion. You get, I mean, you know what I'm saying? So it's strongly suggested that you model the way for your staff. And just because you've been vaccinated, everybody, all of your children haven't necessarily been vaccinated. Even the children in your household haven't all been vaccinated. Maybe your whole family hasn't been vaccinated because they're not essential workers. So you're vaccinated, but everybody else isn't. So, and we don't know, again, if even though you've been vaccinated, if you can still transmit it just because you don't have it. Remember all those asymptomatic people who, you know, never showed any signs, but yet were still passing it off. So it's still strongly suggested that you still wear your masks.
Okay, thank you. Next question is, do you have any idea about the SIDS death in 2020? What are the numbers this year?
I do not. I know we don't have any from our office,
Okay. I will,
which is great.
I will go.
Yes, I do not. But on the licensing call, I don't even think they have calculated any in our areas or just statewide. Because I know on the last local licensing call, they just had it from 2019. They didn't even have 2020 calculated.
Okay. That's good that we don't have anything yet. So I'm going back to chat questions now. What if an analyst catches COVID during the, oh, did I ask that? For a center, how is it allowed to enter in each room where we don't even allow parents in?
Well, we didn't tell you that you can't allow the parents in. That was your decision. We're trying to limit everybody coming in and out. So, you know, those are best practices. But the analysts, again, we have been COVID tested. We'll come in with the proper PPE and we're not sitting and hanging out. We're just coming, we're taking a look-see. We still have to count children. We still have to ensure that it's safe. We don't have cords where kids can be strangulated and things. We want to ensure that there's an even flow of air and things like that. But again, we're just coming in and coming right back out. We're not trying to take up any time in there.
This is a good question. What happens if they scare the kids with all that stuff, that PPE stuff that they're wearing?
If the kids are scared, well, that was a question that I asked the higher ups. I'm coming in looking like I'm going to Mars with the kids. I mean, you know, some may think it's cool, but the other ones are going to be like, oh my God, a monster. And they scream. I'm telling you, the best thing is to have the stuff ready. So we're just kind of in and out where we're not trying to do that. But again, that's why we want you guys to talk to the children about PPE and understanding. You can get a face shield and show them what the shield looks like and have the mask on. The mask shouldn't scare them. And, you know, it's up to you to kind of have the children, hey, these are our friends. They're here to make sure that you feel safe. Do you feel safe? And mostly the kids will say, yeah, I feel safe. Great. You know, and we're just trying to look at the records, or we're going to walk through, go to the backyard, sit down and try to get our report done there. Or they should be trying to kind of stay out of the way of the children so you can tend to the children. But if you have your records and everything to give to us, we can do what we need to do here, you know, once we do that quick little walkthrough, and then we're just listening more so than anything else.
Okay. Is it okay for us to ask for the COVID test clearance before they come in?
They don't carry it with them. If you, I would hope that you wouldn't, but I understand if you would. Just know, and this is what I'm telling you, they cannot come out in the field. They are not released in the field to go anywhere until they have a clearance. They don't walk around with the paper because it's not a paper for them. It's something that comes through the internet. to our emails, but I can ask my higher ups if I can request that the LPAs carry a copy of their clearance with them, because that would be something to show you. If that's something that you would like, I will definitely carry that back and can let you know what they say about that.
Sandra, you had your hand up. Do you have something more to add to this question?
You're muted, honey. There you
Sorry.
go. Okay.
Okay, so I think it was very similar to Valerie's, and I think Shruti also asked the question. So I kind of got answered. So it was about the mask. So my 3-year-old, he's in the ratio with my program, and he refuses to wear his mask because it's his house. He's like, why should I wear a mask at home, you know?
Exactly.
So it's so hard to get him to wear a mask when he's with the other kids, because when we play outside or something, but then I try my best to let him know how it helps him to be safe and stuff. But most of the time it's a struggle.
Kids are kids.
Yeah. So yeah, that was one question that got answered. And the other one was about the vaccination, right? Like when you get vaccinated and the parent also gets vaccinated, is it okay for us to meet without the mask? I know. I think
we strongly suggest that you wear the mask. That's all that I can tell you. We strongly suggest that you wear the mask. But if you and that parent are comfortable with meeting without mask, that's between you and that parent. But understand that if another parent sees you and you run the risk of getting a complaint called in, you run the risk of things like that. So we strongly suggest during business hours that you keep the masks on.
Okay, I totally get it, but I just wanted to see how the regulations are going, because in some cases, I don't even know clearly how one of the parent looks, because I've never seen her without the mask, you know?
Absolutely.
Because she enrolled in the program and there's no connection between us because we're not seeing each other.
Well, you can always have a Zoom interview or a Zoom talk so you can see them without the mask. You can always ask them to meet with you outside of the home so you can see them without the mask. Remember, these are your homes and you have to maintain the safety of your home. It's your business, but it's out of your home. So more than anything, make sure you maintain that safety for your family, if nothing else.
I agree.
So you can always have parent meetings via Zoom in the evening. That way say, hey, I can talk to some adults without a mask. And, you know, you can begin to share information with them and say, I just really want to see how y'all look. I don't remember how y'all look outside of you got blue eyes, you got brown eyes, things like that. So those are some suggestions that you can do with the parents.
Okay, thank you.
You're welcome.
Okay, the next question is, I would like to know where I can find protocol checklist.
The protocol checklist as far as for the analysts when they're coming through. Is that what you're talking about?
Yes.
Oh, okay. Oh, Valerie, look.
Well, I know it
Hi,
seems so new.
Valerie.
Hi.
I love Valerie now. No, there is no protocol checklist that you guys would see but you can, if you look in the pins, I'm not sure which pin it is that talks about the new IPP tool that's coming out. That tells you about the annual visits when they will resume and everything. It kind of tells you like an overall of what we'll be looking for and everything, but there is not one specifically online. But as I stated, I am trying to get someone from our training department to maybe give you a better understanding of what we'll be looking for and how we go about doing that. All of our analysts have been trained on that. And I'm trying to see if they can do it for the providers, because I think it's important that you guys have a heads up of what it is we're looking for. I do try to have my analysts give you guys calls and say, hey, make sure you got this, 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 and this, you know, and that's the bulk of everything. And the more you have, the quicker we can get in and out. So there is not one online, but I am trying to have them get on a call to give you guys an overview of such. I'm trying to do that, and our next call is on the 18th. I see you, Chris. Is it Christy?
Christy.
Yes. Hi, Miss Christy.
Hi. You know, the inspection tool that they're going to be using, Is that the same pilot that they were using, that they said they were going to use maybe like a year and a half ago or so?
It has been revamped. They've added to it. So remember, we've been doing these inspection toolkits. Oh wow, they were doing them back when I was an LPA, and I've been a manager since 2016. So they were doing inspection tools back then. We had toolkit 1, toolkit 2, toolkit 3, and then they shut that down and they started more. So this is a newer toolkit per se, but it's called IPP, and I can't tell you what that stands for right now. I have so many acronyms floating in my brain, but it's the newest inspection tool. So they did start it about a year and a half ago, but they have added more things to it, fine-tuned it so it can be more user-friendly and more beneficial to get us in and out of there. Okay.
Thank you.
Thank you.
Can
Welcome.
you request a virtual visit?
Of course you can request one. I don't know how that's gonna work out. I would want to say, I don't know, I guess it would be a case-by-case basis. I can actually elevate that up because I'm not sure what our higher ups will say. And the way that they think of it, they being programmed, is if you are having children from different families in your home, why can't we come into your home? It's no different. Though you see them every day and you kind of have a feel of where they are. But again, like I said, when they leave you, you don't know where they go overnight and what's happening. So you can actually request one. We will probably, the analyst will probably elevate it to the manager, who will elevate it to me. And my question will be why? Why is it that you need a virtual visit? And then we would do it on a case-by-case basis. If I get inundated with requests for these, then yeah, I can't see it constantly going. But if it's for a legitimate reason or something, somebody just had the first vaccine, you want to wait until they get the second vaccine or something like that, and you have proof of such, you can show us proof of such. It may be something that we would consider, or somebody in the home is sick right now. You know what I'm saying? And then my question would be, but then why are you open to children? So, I mean, you know what I'm saying? We would be asking those who, what, when, why, where, and hows to see if that's something, but all we can do is say no. So nothing wrong with requesting it. All we can do is say no. That's the worst.
Victoria, do you want to ask anything more to this question? Or you have to unmute.
Can you hear me now?
Yes.
Okay.
I can hear you.
So, like my granddaughter, I watch her, she has asthma. So I've really, I cut down, I didn't take new people because I really want to make sure that, the kids that I have here that have some little health issues, we don't have as much traffic. That's why I asked, for your safety and mine and for these little ones, if we're willing to do a virtual, you can, I obviously you could do it whenever you want, but I mean, I would be ready to take my, I would just feel so much better. I mean,
I understand your concern. I definitely understand.
I
your
mean,
concern.
I have been really careful with people coming in and out. I mean, we have a designated person that does grocery shopping in my house.
Mhm.
So that, I'm not put out there on the forefront, because I'm interacting with these kids. And so I just know that the peace of mind that I could give to the parents saying, look, I'm doing everything I can. I'm being as conscientious as I can. I mean, I lay in bed every night and I think to myself, what can I do better?
Mhm.
All the time. If you came into my house right now, I'd be ready for you.
Mhm.
And so, I mean, you can never be too safe, but I just would feel like my numbers would be even lower because you're out there, even though you're doing the best you can, for those of us who would really like to just hunker down for just a little while longer, tomorrow I get my second vaccination. But I just, if we could be offered, I mean, like you said, some people are not good with the iPads and everything else, but for those of us who can, I mean, goodness, you could really, do more than two going through a house. I mean, I could scan and documents to you to show you that I have, properly done my rosters and that the daycare kids, I mean, I can have all that ready, for you real quick.
So what I can tell you is you can always put in a request, but I can't guarantee that that's what's going to happen. The virtual visits take a lot longer. And if you could think from our perspective, we can't definitely see, we can only see what you show us. So that doesn't give us the calm to know that everything is done, which I know in your mind is like, no, but I'm showing you everything that you need. I'm going through every inch and all of that. We've been through that with the RAS calls. At some point, you have part of you being licensed indicates we have to come and do an inspection. None of us foreseen COVID coming. So I understand your concern. I understand your frustration. All I could say is put in that request. They can submit it to me and I can talk to my higher ups about it, but I'm not guaranteeing that we won't show up at your doorstep. That's all that I can tell you.
I guess what I'm surprised, I guess, for some people, they work real hard diligently to do
Absolutely
what's right. And,
yes.
There's got to be a way where, you can say, I mean, I guess people are going to cheat. I guess that comes down to the, I could take a video and video my whole house for you, real quick.
But unless I've licensed you, I'm only seeing what you've shown me. Unless I exactly remember how I licensed you. I have pictures knowing where everything was. So when you do that video, that's not helping me. And again, all of our analysts are new. So many of them have never even met me, except for on that RASC and that virtual call.
So Anika,
so, yes, ma'am.
Can we do this, the visit, can we ask before or after our daycare hours? So that there is no contact with the kids at that time. Is that a possibility? Like
you can always ask and we can definitely elevate it up. You can always ask. And again, that's a case-by-case basis. But how is that fair that you don't get in a visit, but everybody else get an in-person visit? If we're not doing the in-person visits, what are we having the call for? What did you guys do the petitions for? We can just do RAS calls and then they would be doing work out of classification. Their classification is to be in the field. We got all of this grant money poured into CCL childcare, even through some of the resource and referral agencies and everything in anticipation for us amping it up because this is what the public required. They wanted more frequented inspections. We went from having visits once every 5 years to once every 3 years to now they had all of this money poured into it to have a visit every year.
Yeah, but we can always request that visit because we are in the midst of a pandemic and the situation.
You can request it, and all I'm saying is it's not a guarantee that you're gonna not have an in-person visit. That's all I'm saying, but I definitely will elevate it and share these concerns with my boss as well, and let them know the concerns that are out there in the, yes, ma'am, Miss Victoria. Yes,
okay, so last year when I had my licensed person come out to my home, I told them, I said, the bulk of my kids I'm picking up. So if you could please be here anytime, Monday through Friday, before, we could be done by 12:30, because I have to pick up at all these schools. And now the requirements are even more stringent because all the kids start and are picked up at the same time. So the schools are not happy with having children in an office. So last time I asked them that, I said, I knew my time was coming up. I had everything ready to go, literally everything. I had everything on my table. And she came at a time where it wasn't appropriate. And I had to call my schools and tell them, please hold on to my kids. I have licensing here.
Okay, so what we're gonna do is you can email me that particular situation.
Okay.
And we can have a conversation about that analyst and what that entailed. Because all I'm hearing is what you're saying, and I
Yeah.
hear what you're saying, but understand, we ask you your times, you know, we look at your application, the time that you say you're open, so we can come anytime during that time. But if you specifically talk to that person about that, so that's a case by case thing, and we can talk about that where we're not taking up everybody else's time. Shruti has my email and it's open to all of you. If you guys have specific questions for me, you can do that.
Yeah, I'll share it at the end of asking questions. Christy, you have something to say? You're on mute, Christy.
You're muted, Christy.
Sorry. With the vaccine, and you're saying you're going to be starting the visits in April.
I believe it's in April. It might be May, but I think it's April.
I'd be so much better with May. I'd be so much better with May. Because my thing is, we're just now getting vaccinated. And to have somebody come in, my anxiety level will go from the roof way down if I know that I'm protected. I mean, I still have to worry about the kids. The kids are definitely a concern, but just the fact that I'm protected is humongous to me.
Mhm.
Humongous. And so that's why in April, I'm like, how many of us are not going to be fully vaccinated? Quite a bit.
Mhm. So with your petition, these are all of the things that have gone forth. And hopefully I'll have some kind of answer for Shruti by Friday, because I definitely elevated it up. And as I stated earlier in the call, we have these same concerns about you all, about our own selves. Everybody in our offices aren't vaccinated. Everybody is not planning to get vaccinated. It's not mandated. It's not a law. It's not required. And so again, everything is fluid. It's ever changing. I really do hear your frustrations. I share your frustrations. I know it comes off sometimes as CCL seems a little problematic and uncaring. That's not it. That's not it at all. We share your concerns and we elevate them up. However, understand that the rules and regulations and things that are being mandated are statewide. They are coming from our governor's office. They come down through agency and we have to decipher them and we have to go through all of them. It's tough. It really is tough, but the more we partner together, that's why I stated a lot of things are on a case-by-case basis. I don't want to take you guys' evening up and I don't want my evening to be taken up too much more.
Yeah.
But we have to take it on a case-by-case basis. Everything is not blanketed. You know what I'm saying? There are some mitigating circumstances. There are people that have underlying conditions and they're like, oh, I don't want anybody coming in my house, and okay, well, this might not be the field that you want to be in. I've had a lot of people tell me that, well, I have underlying issues. Well, guess what? I have underlying issues too, and I have to go in the office every day. I've been diagnosed as a diabetic for years. I have an elderly mother at my house that I take care of that's over 70. And I have to go out and come in every day. I have 2 college students. One is on campus and one is in the house. I mean, you know what I'm saying? And so I have to navigate through all of these things where I come in the house like, hey, mom, you know what I'm saying? You all right? Go upstairs, strip, take a shower before I even come and be able to woosah and eat dinner and things like that. So we're all in this and we're all navigating and doing something different that we're not comfortable with, but we got to do it. So if there are some individual situations, you guys go ahead and email me. We can talk about it. My work phone number is area code 510-286-4350. That's my direct line. I have no problems giving that to you guys. And give me 48 hours because sometimes I'm not in the office, I'm working from home. It's 4350. My email is anika.evans@dss.ca.gov. That's spelled A as in Adam, N as in Nancy, I as in ice cream, K as in kangaroo, A as in Adam, .Evans, E as in Edward, V as in Victor, A as in Adam, N as in Nancy, S as in Sam, @dss.ca.gov. I will definitely try to, thank you, Donna Marie. I will definitely try to answer all of your questions. I encourage you all to get on our call. Those of you that can, it's at 2:00 on the 18th, but know the one that we have in April will be in the evening, so it'll be a little bit more convenient for you all. Our advocates are always available to answer your questions. We always have 2 analysts on duty in our office Monday through Friday, 8 a.m. to 5 p.m. to answer your questions. Whoever your analyst is of the area, you can call our front desk, which is 510-622-2602. Ask for a desk duty officer, and they can get you to the proper manager of your analyst in that area.
Okay, we have some more questions. Am I on muted? No. So large family childcare, 12 children enrolled, 2 of those children are enrolled in kindergarten until August. Oh, sorry. 2 of the children are enrolled in kindergarten, but will not start attending kindergarten until August 2021.
Then they're still pre-K. They're still preschool until they actually start attending,
So they
even if
cannot-
it's virtually.
So the provider cannot count those 2 children as school age and use the 30.
Not until they start attending, virtually or otherwise.
Okay.
And
Next.
so we have been known to ask for proof of such.
Okay, thank you. Next question. Can you have 4 toddlers in a water play table or a small pool in the summer?
That's a new one. I don't see why not, as long as there's somebody supervising them, and when they're no longer using that water has to be emptied out.
Okay. Robin, I see your hand up. Do you have a question to ask?
I was just, I typed it in the chat also. I was just wanted to clarify, because I know this was asked earlier, but I didn't hear an answer to this part of the question.
Okay.
Are the sleep logs for infants up to 12 months or up to 24
Oh,
months?
I didn't answer that, huh? Oh, yeah, I remember that question now. Is it 12 months or 24? I believe it, I thought it was 12 months. It's 24, it's 24, okay. So that, I'm not sure on, but I can definitely back it up with the regulation and the sleep code that they gave on the pen. I'm not well versed in that, but so I see Lisa said it's 24 months, so I believe it's 24 months.
The problem with the way that they word it is they word it for infants. And a lot of people don't understand that license considering infants to be up to 24
Up
months.
to
not
2
12
years
months.
old. Yeah.
Right. So that's what it says in the stipulation, that infants. Well, infants are 24 months and younger.
That's true. That's true. Because 2 years old or 24 months beyond, then that's considered a preschool. So an infant is up to 24 months.
The next
thought-
question. Sorry.
Sorry, I thought that it was 12 months just for the fact that that's kind of when they're able to roll over, and they're, well, obviously roll over way before then, but like the chances says is less likely. So it is up to 24 months. Okay.
That's an infant. That is the definition of an infant.
Right.
I know the 12 months is more so for them being in a crib. 12 months is when they're in a crib.
Okay, the next question is, how about the capacity waivers that were given before? Are they still being issued on the need basis?
I'm sorry, can you repeat that? I didn't hear you.
How about the capacity waivers that were given before? Are they still being issued on need basis?
Oh, let me tell you how much I hate those waivers. I absolutely hate those waivers. And I think what it did is confused and convoluted a whole lot and made more of a liability for many, for licensing and even for yourselves. The waivers, it depends on what the waiver is for. You can always request a waiver and an exception, but there is a need by need or a case by case basis depending on the nature of what it is that you need. But we are really trying to downsize on all of those waivers. I personally have had a problem with them issuing waivers to people because the waivers go outside of the regulations, and you have a lot of people who were not licensed providing care, and they were not held to the same standard that you were. We can come in your facility and cite you. We could not cite them because they weren't licensed. So they are coming to an end. They stopped giving the blanketed waivers. And so it is a case by case basis, depending on whatever it is. But I've seen a lot of childcare centers and family home care facilities that have taken such advantage of that. And it really does do the children a disservice because they want to get more children, or they want to allow their kid to be, I mean, it's just been a whole mess. So if you can stay away from a waiver, please stay away from a waiver, but it is on a case by case basis.
Okay. Alondra Santos, I'm sorry, I couldn't understand your question. If you want to unmute and ask Anika your question.
And Donna Marie,
Alejandra.
thank you for answering some of those
Alejandra.
questions in the chat. Thank you so much.
Alejandra, are you there?
No, okay. Donna Marie, do you want to ask the next question? Because
Alejandra, you have to unmute, honey.
Hi, you guys calling me?
Yeah, yeah.
No, my question was about the age of sleep long. They sleep long.
Okay.
Yeah.
Okay, so we answered that for you? Okay.
Yeah, thank you.
Okay, you're welcome.
Yeah, so there were a couple of questions that came up that providers forwarded to me. And one has to do with a large family home childcare, fully enrolled, and parents have asked the provider, would she provide tutoring services? And hoping to be able to, you know, make money. She would like to provide those services. She has 2 staff people who can run her program while she meets in another area of the house with the child being tutored. That child is not enrolled in the child care program. Okay, but I just want to fly it by you because it's not me. What do I know? Nothing.
Yeah.
And so the question was, if that can happen while her program runs, if she can meet with a child to provide services, would the parent have to be with the child, therefore supervised,
Mhm.
for her to be able to do that?
No, I don't think that she should have that extra child that's not enrolled in her program in the facility at all. If she wants to tutor, she needs to do it after hours, or she needs to do it over the weekend. Reason being, any children that are in the facility at that time needs to be accounted for. We need to have records of them. Even if their parent, and it makes no sense for you to tutor them if their parent is right there, right? So she would need to change those hours and adjust them to where she could meet with them after her daycare hours. You're mute. Oh, there you go.
do you have any other questions? No, okay. The next question is, family childcare is not required to keep sign in and sign out sheets, true?
Correct. They are not required to keep them. They're not required to do them. It's always a good practice, but I mean, you know,
Too much.
save the trees.
The next question is, providers tell me they don't want to wear masks in their daycare. Is that an option?
It's not an option. again, these are best practices and things that we are strongly suggesting. What I'm telling you is you're opening yourself up for problems. You're opening yourself up for complaints being lodged against you. It's not just licensing that's strongly recommending you wearing this, but the CDC, Department of Public Health, the news, the entire state is really pushing and strongly suggesting that you are wearing masks during your daycare hours. So please comply with that. But it is nothing that we can cite you for because it's not under our regulations as of now. But we do strongly suggest such. And if you want to limit trouble coming your way because you guys don't want us to come, don't set yourself up for a complaint being lodged against you, because please believe we get complaints every day. They're not following COVID protocols. They're not wiping this down. They're not wearing masks. So that makes us have to come out more.
Oh, I lost a lot of questions. Let me go back. I'm sorry, I lost a few questions. Many families are planning spring break vacations to Hawaii, etc. Is the quarantine requirement still there, even if some parents and I are vaccinated, but the kids are not?
Quarantining by way of them staying out of the facility for 10 days after they've been traveling abroad, that? Well, again, that's not regulated. It's something that we strongly suggest. I personally am going to Hawaii next month for my birthday. My daughter is taking me, yay. But I know that they have, thank you, I deserve it. Thank you, Elaine, I see you. So, but they have to be COVID tested before they get on a plane and everything like that. Strongly recommend, as in Lisa Erickson would say, is that they would take some days and stay home to make sure that everything is okay. But again, it's nothing that is regulated, but we strongly recommend that you be wise in such. When I come back from Hawaii, am I coming right back to work? No, I'm gonna be off for a few days, at least 5 days, to ensure that I'm okay. And I will, as soon as I touch down, I'll be getting COVID tested. So I'll wait until I get those results from me being back. So that takes 2 days. So they won't see me for a whole nother week. So it's not mandated, but I highly recommend it that they do.
Okay. Next question is, if we have reduced hours for COVID instead of the licensed hours due to COVID, do we need a waiver for that too?
No, not at all. You just need to let your LPA know that you've reduced your hours, so we know what times you're open and what times you're closed. Yeah, but no waiver is needed for that.
I hope I read all the questions on the chat. If anybody else has questions, please unmute and ask Anika.
All right, that's awesome. And I'm sorry if you guys hear talking in the background, but as I said, my daughter, my sister, and my niece, they're planning my little birthday trip. So they're in there and I'm like, but I'm at my sister's house, so I can't tell her to be quiet in her own house. So I'm in her office, which is off to the side of her kitchen. So I do apologize for my background noise, but I hope I was able to answer you guys' questions. I see you, Lisa, go ahead.
I just wanted to thank you for your time this evening. I know it's not easy to handle all of us at the same time, and you did a really good job. I appreciate your time. I appreciate your candor. And, you know, we got to all do what we got to do. You know, we choose this business for a living and we have to do the rules, you know, and like they said, you're going to take certain circumstances in, you know, consideration. You know, it never hurts to ask, but
and that's all you can do.
Yeah,
thank
I
you
just want
so
to
much
thank you for your time.
Thank you. I appreciate you all, and I really don't mind doing these calls. Shruti is so nice. She actually gave me options. You want to do it this day? You want to do it this day? I was going, oh Lord, I'm going to be in front of the firing squad. But no, it's thank you to all of you guys. You guys are so welcome. You guys know I have no problem telling you, I don't know. Let me look that one up. Let me see. But you guys have an amazing resource in Donna Marie.
Yes.
You have an amazing resource, and I'm here to help you, but I really meant what I said when I say we're in this together. I really do understand. I'm frustrated with you guys. I'm frustrated at what you guys have to do. So I get it. I get it. So don't just think I'm just, no, you got to do this, you got to do that, because you don't have to do that. You don't have to do that. A lot of things are not regulated during this time, but we want to take the most necessary precautions to keep you safe, keep the children safe, and even keep our staff safe. So it's a case by case. You guys go on and send them to me. And the worst thing I could do is say no. That's it. I mean, you know what I'm saying? And usually it won't be me saying no just because I'm being mean. It'll be no because I've sent it up the chain and they're like, no, we can't do this. And that's what it is. So it's not really my decision in certain things, but I really encourage you, go ahead and send those questions, those requests. I will definitely elevate them. I am so, don't tell nobody, I'm proud of y'all for that petition. I'm proud of y'all.
Thank you so
Because
much. That means
I'm
a lot
serious.
for all of us.
I am so serious. I'm in a position where I can only do so much, you know, and they consider me a rebellion because, you know, I'm the one that, nope, why? I don't understand. I mean, you know, literally they try to keep piling work on us. Well, no, they need to do this. They need to do this. Stop. We're people too. You know what I'm saying? These people don't want us coming in their house and we don't want to go in their house. You know what I'm saying? So we're trying to look at all of those. And what I try to do with my team is really work smarter and not harder. And that's why we want to partner with you. Like I said, we move into this consultative mode. We want to work with you. I don't want to cite anybody because it's so much more work for me. And I don't want to do that. I'm people may not think I'm old, but I'm older than I've ever been before. I am 48 and on my way to 49. And so, but I realize I'm on this second stretch of life. I want to relax a little bit. You know, I don't want to do the stress and everything. And we deal with enough of it outside of our homes and outside of our businesses. So I'm very easy to talk to. I'm very approachable. All of my managers are approachable. I don't like the clipboard commando thing. I just want you to be right so we can be right together. But please, please, please don't hesitate to email me. I appreciate you all. Mwah. These are my COVID kisses. Mwah. Because I can't touch you, and my jellyfish hugs. I'm hugging you all. Thank you. That's what I do with the kids. I'll be like, jellyfish hug from over there, from over here. So thank you guys so much.
Thank you so much, Anika. And as we speak, we are 492.
Yes, thank you.
So we are collecting signs every second, it seems.
Absolutely. So I will ask them first thing in the morning, what y'all want me to do with this? Then I'm gonna tell them I'm gonna put it on thick. I was in front of the fire squad. These people were mad. No, they were awful. You don't want them coming out with picket signs. Y'all better figure something out. Don't do it.
Thank you so much.
I got y'all back. See, before I was in management, I was high on the union. I was a steward, so I understand. So I'm in the fight with you guys, okay?
Thank you so much. We really appreciate your time. And you're not taking part in the planning of your birthday, so we feel bad, but enjoy.
No, it's okay. It's okay.
Enjoy Hawaii.
They paying for it, so it's okay. I'm telling you, I raised a good girl. She's smart a little bit. I like it. I like it. She's going away to college, so she won't be here for my 50th. So she was like, well, let me get mine out the way now. And then, you know, she'll be away.
Oh,
so, yeah. So thank you guys so much. You guys have a wonderful evening. Stay safe, mask up, and remember to breathe.
Happy birthday.
Remember to breathe.
Seriously. In advance, Anika.
Thank you. It's next month. I'll make sure you guys can send me gifts. Okay. Just kidding.
Thank you.
Okay. I can't accept gifts, but it was
right.
So, okay.
Have a good night.
Good
okay.
night.
You too. Bye-bye.
Bye-bye.
Anybody on this call wants the link to petition, it's in the chat. And please forward it to anybody and everybody you want so that we get more signs. We're at 492 and we started this petition yesterday. And the more signs we get, maybe we can move and make some people hear it at least, if not any. But I would like to thank Vicky from Coco Kids and Donna Marie from Hively, who are on our call and are backbones for at least us
guys.
at VFCCA, and we really appreciate you always supporting us. So thank you so much.
You're welcome.
Now we
Our
can
pleasure.
chat. Oh, let me stop the call. Oh, this call is recorded. So anybody who missed this call and wants to forward it, it would be on our website, which is, anybody knows the website? familychildcareassociation.com. And
Thank you to the ladies
I
from
was
my
just thinking-
caseload for coming.
I was just thinking though, for somebody like Valerie, it's like, if there really is a health issue in the family, they should just try to be a little bit more respectful for that. I mean, not everybody's going to say, don't come to my house, but certain people, give them a break.
okay, let me stop recording, please.